per
Oh,
se.
okay.
Yeah, not cancer per se, but we have done for the last, from the time the lockdown was announced, we have been doing something or the other.
Oh, that's great, but it's a great cause. I really
Yeah.
like what you're doing. You're giving a wonderful opportunity to all of us here.
Yeah.
Yes, hi, Rob.
We got our old doctor come back, I think.
Oh, who's that?
Dr. Christina, I think it should be.
So that's me. Okay, so she's come back, Christina.
I think so.
That's me, Rita.
I think Roy can see you now.
No, she always hides from me. Unlike you.
Did you see me? Rita?
Yeah. No, we can't say Christina so far.
No, not Christina, Rita. This has come as Offrey Joseph that I'm seeing.
Oh, that's you.
That's me, yes.
Oh my God. But why did you change your name? Just for this one show?
Offrey Joseph coming as Offrey Joseph there.
I thought that I know, and I said maybe somebody else, you know.
That's my husband's name.
Okay.
Oh yeah, there's I'm seeing there are I mean
Where's
there are
Tina?
some
They're
of my
calling for
friends.
Tina.
And Christina, I saw Christina also somewhere.
Christina.
Oh,
Yeah, she's coming
Roy,
away.
the other part is how do I share the presentation? That's the main
And
thing.
you will be the 1 minute. No, you will be the co-host. 1 minute.
I see. No, it's.
Yeah.
I'm thankful I asked because.
No.
Oh gosh.
This is more like a family affair, you know.
Yes, indeed.
So, and
All these spots will come on this. There's so many spots on the screen like that.
okay. So now you are the co-host too, Philomena.
Oh yeah, so I can say.
Yeah, you can start sharing the screen, you know. If you got a
so
presentation, a PowerPoint or anything, whatever you want to share, you can share.
Now, how do I do that? You
Go
know, I've
down
never done
at the
this
bottom, there is something, green tab called Share
Share
Screen.
Screen.
Yeah, you
Yes.
click on that.
So I just click on this, yes.
And then we are seeing some European mountains, I think, Alps. What is it?
No,
Share
it's
the
just
screen.
this blue screen, yes.
Achha, okay.
So you can see this one as yet?
Yeah, webinar.
Oh wait, but no, that's just a poster. Where's the present? Oh yeah, here. Slide, let me just see, view slideshow.
You want to see?
Yes, does that work?
Yeah, just put it on and see how it's happening. Now the controller is with you.
Right, so is this big screen coming in the middle with all our faces and all?
Yeah.
Yeah, oh.
It's perfect.
So,
Screen.
no, but can you see all the points on the slide?
Yes, we can. From national awareness to eliminate.
To eliminate. Oh, okay. So the last sentence for this one?
Last sentence now is novel treatment, genetic.
Okay. So then you can see the full slide, right?
Yes. And on the top it's lung cancer facts.
Yeah, on my screen it's coming as, the last line's getting hidden. So I'm just trying to make this.
We can see the full screen.
Oh dear, how do I make this?
On the PowerPoint on the top left will be full screen. If it's a PowerPoint.
Yeah, it's a full screen at the moment. No, it's just that I'm trying to work out how to. I'm trying to work out, Roy, how to take off. All our pictures are at the bottom. So what's happening on my screen? That the last line is getting hidden.
Achha.
So yeah. Oh no. Now how do I stop? Wait, I'll just stop share because I'm trying to work out how to do this.
Philomena, you can take all our pictures on top. You can drag it on top, or you go to view.
View, yes.
And you put speaker.
1 second. View. Wait, now where is that view?
Right on top.
No, suddenly I'm so not savvy.
View.
View.
Yeah, it's views on speaker. Okay.
Yes. Okay, views on speaker. That's right. Okay, great. What I'll do, I'll try to make this just smaller. I'm sure I'll be able to do that. But I just want you to see the, the slideshow on full. That's the thing. Okay, layout. No. Let's see again. View full screen. Okay, now can you see me?
We can see you clearly.
All right, all right. So now I have it like this. So I'll just leave it like that. But then I stop sharing my screen, isn't it?
Yeah.
Wait, so I'll just put that back. And yes, now I got it. Thanks. Yeah, that helped. Now, share screen. This one. Yeah. Yes, has that worked now? I think so.
It's better.
Yeah.
Okay, so then I'll have to make it a full.
Just do slideshow and current slide. Or from the beginning.
These are just all of us. I see. Okay, now.
Philomena, if you need any help, we can export Angela from here.
Yes, but it's not so bad, isn't it? She's more tech savvy than I.
Yeah, so we'll send her there on a 3-day visa.
How do I get mom's picture on this? Something, because sometimes it's nice to have a face as well.
Yeah.
So I don't know. I've got everybody off except myself here. Because I wanted to see all of us too. Or maybe that's all right. Let it be.
Anyway, the question answer session will be at the end. Na? So then,
yes.
Yeah, then you can have.
Okay, fine. We'll do it that way. Yeah, as long as now you're all able to see it, let it be this way.
Yeah. So now you click slideshow and put from the beginning.
Like that?
Yeah, from beginning.
And then this I'll leave down here. So I think now I'm able to see it beautifully. Yes. So Ro, you tell me when to begin, or whenever you wish to. So
in another 2 minutes from now.
Sure.
Meantime, yeah. Okay, we are live on YouTube. Huh?
It sounds wonderful. I was anyway planning to have a summary, like a summarized video for November. Because I don't know if you viewed one of my videos last year. I did one for November 2020.
No, we haven't, because these are all accidents.
From Assam, yes.
Okay.
We had so much trouble that time because it was raining and pouring and she couldn't connect. She did it through her telephone. Seems to be less challenging from Sutton.
Yeah, I set this up last night actually because I was so nervous that I will not be able to set this up today in the morning so early. So I had checked it out, but anyway, few little hiccups here and there, but it's all right.
It's all right. It's all right.
As long as I have my presentation up here now.
Yeah, it's there and up and running, and we'll wait for 1 more minute.
Sure.
Rita, we can wait for 1 minute.
Oh yes, we'll take it.
Normally, by the end of the program, we should be hitting at least 75-80. So people start walking in late normally.
Yeah. Wait for 5 minutes if you like to. Let them come in.
That is
That's fine.
They shouldn't miss the beginning as well.
Yeah.
Wait.
Yes, some people, what happened, Roy, with 12 o'clock, they are part of these AGM meetings in India.
Yes. Not only AGM, there's cooking. The ladies have a major role to play, no? And the ladies are the main. If you see, there's almost 60% are our lady folks. So,
yes, the women are part of this presentation as well, mainly.
Yeah. So, then that's how when they adjust, but everybody's adjusted beautifully. Yeah.
That's really sweet. Yeah.
The first time we started with a cooking bakery show when we had Mercy from Lokhandwala. Yeah. She came online and she did it. 3 o'clock was the only time available that day. So I said,
Oh.
Mercy, you do it on 3 o'clock, 3 p.m. afternoon. She said, but
Right.
it's a sleep time when everyone is at siesta. I said, no, don't worry. Even 25 come, it's okay for us. We'll get started. And
Right.
we got rolling. And I think more than 80 people turned up that day.
Oh my goodness. Wow.
Yeah. And suddenly, then 3 o'clock got slotted as the cooking and baking show. Then
Right.
doctors came at 12 o'clock. So we slotted 12 o'clock for doctors. Then Friday, Saturday was do it yourself. Thursday was craft and tricks of the trade. Then Tuesdays was musical. We have got a few teachers who are teaching free. Yeah? What they normally charge here, 500 rupees
Right,
per
right.
hour, they're teaching free of cost.
How sweet. That's really wonderful.
Yeah, many are learning guitar, keyboard, everything, all free. So like that, one by one, this slowly kept on adding up. Hopefully,
Wonderful. Oh, so every time someone enters the room, there's a sound, is it?
yeah, we can mute that sound.
I see. Mute.
That is just to keep me on the alert, Somebody's
Okay, I
there.
don't know how to mute it, but anyway, we can.
We are hitting 28 now. I think at 30 we will start.
All right. Yeah, sounds
Yeah?
wonderful. Yes, I agree. I didn't expect even 25 people to turn up, so that's a lot. I'm just looking to see if there are any friends around who I know on.
You have a friend here.
That's Ravi. Hi, Ravi.
Oh, that's so sweet, Auntie. Thank you for coming on.
My pleasure.
Actually, thank you to everybody, whether I know them or not. It's so lovely to see them all here. How sweet. But yes, Auntie, thank you. Nice to know some known names.
She was my
Great
best
to
friend
see
in
you.
school. We were in school together in Barnes.
Yeah.
Devlali, the Barnes school in Devlali.
Jablali.
Yes.
Okay.
Yes.
And my biggest competitor.
Oh my God. It stood no chance with Rita. I think Christina's also online, right?
Yeah, yeah.
Christina's watching. Right.
Watching.
Yeah. Great.
Hello?
Yes, we have.
But she wants her mother and sister to be basking in the sunlight. So she's in hiding.
Always like that.
She's done a beautiful show. Huh? The thing was that nobody's letting her go now. Yeah, I think
Tina's friends want to join. Yeah, they join. Of course, they can join.
yeah, anybody can join.
Anybody can join.
Yeah, there's no
Yeah,
caste, no
actually,
creed, no
with the ID, with the ID and the password, anyone can join.
anyone.
With the
Yeah.
ID and password, anyone can join, Tina.
Anyone can join.
This was really easy, Roy. I didn't know you can just have a meeting ID and a passcode, and that's it. You can just log on.
Yes,
So
yeah.
easily.
I think we have crossed 30, 31. Rita, shall we start now? What do you
Up to you. You want to wait for 2 more minutes?
We can wait.
Wait 2 more minutes. Please.
Okay.
Okay, fine. So after 2 minutes, we will start.
Because now you will find that every minute somebody is trickling in,
Yes.
Yes, exactly.
This is typical Indian attitude.
So even if they miss a little bit here and there, it's all right. We
It's
will.
all right, yeah, they can see.
We'll still create quite an impact, I'm sure.
Yeah. And then they'll be watching the YouTube also, no? Later.
Yes.
And you could start then, please.
We are 31. We'll wait for 2 minutes. 33. At 25, we said 30. At 30, we said 30.
Before I can start, only if I'm laughing like this.
Okay, the next one, whoever walks in, will start.
Yes.
We won't delay. We'll respect those who have come in on time. No?
Yeah, exactly.
Yes.
Oh dear, it's gone back.
It's taking time. Shall we start then?
We can start. We can start.
Yeah.
Yes, Roy.
All right. Good afternoon, everybody. And
Yes.
once again, we are at our Medici show. We were fortunate, I think, about a month earlier to have Dr. Christina, the famous orthopedic. She's entering now. And who did a show with us, which had a wonderful response. And today, we have her elder sister, Philomena, and her mother, Dr. Rita Joseph, who were quite impressed with what we were doing, that they volunteered to give us a talk on lung cancer awareness. To tell you a little about Dr. Rita Joseph, she is a general surgeon practicing in Bombay for over 30 years. And her daughter, Philomena, is a biomedical student, a scientist in genetics and molecular medicine from the University of Sheffield and the University of Copenhagen. Having spent the past decade in research across fields, across cardiovascular, neurosciences, stem cells, and oncology, she has taken it upon herself to be an active advocate in creating a lung cancer awareness with an interest in the genetic basis of this condition. With these few words, Dr. Rita and Philomena, the floor is all yours.
Good afternoon, Roy, and all those who have joined in this meeting. I'll hand you over straight away without much delay to Philomena.
You have permission to record?
Yeah, it's live on YouTube. Christina,
Yes,
you want to
thank
record? No, one moment. Christina, you want to record?
Yes.
1 minute.
Yeah.
1 minute. And now why doesn't it say? Just see if you can record it there. Okay. So it started recording. Yes, Philomena.
Yes, so sorry about all this minor delay, but thank you so much, Roy, for that brief introduction and for giving us an opportunity to be part of a lung cancer awareness and erasing the myth webinar. And I'm so grateful to all of you who have come in support of my mom and I as we be an advocate for this. So today in my webinar, we're going to touch upon a few topics. One of the types of lung cancer I'll be focused on is the non-small cell. Advocating for a new era of warriors. We'll talk about a few gene mutations. And also we will look at breakthrough therapies that are present in today's time. Oh, Roy, how do I move forward from here? Oh, okay. So the month of October is actually Breast Cancer Awareness Month. And Roy, there's a lot of this noise coming in from from the audiences zooming in each time. How do I get rid of that? I can't mute it. Can I mute other, maybe if we mute other participants?
I muted that.
Oh, you've already muted that because, you know, whoever's signing in, it keeps making a ping sound. Don't know why that happens. Anyway, I'll have to try and not get too disoriented with that. Yes, so the month of October is Breast Cancer Awareness Month. And I'm getting very distracted with that noise. Oh dear.
1 minute. Let me see. We have never.
The constant pinging is making it a distraction for me.
Philomena, since you're co-host, that's why anyone joins it, you'll get that alert, you know. So if
I
you,
see.
yeah, so if you mute yourself, then we will not be able to hear yourself.
yeah.
So that will be,
No, it's all right.
Yeah.
Let it ping. So.
Okay. Yeah.
All of us are hearing it, but not only like if
Yeah, all of
anyone
us.
joins, we are all hearing.
All of
Yeah,
us.
but it's pretty disturbing when you're trying to have a flow here. Anyway. Because, you know, Angela, most of my speeches are all extempore. I never prepare them. So, you know, it's like setting up your sentences and then it just gets a little bit distracting. Anyway, I'll do my best. So if you see pink ribbons, we all are aware it's linked to breast cancer, but sadly for lung cancer, some of us don't even know what's the symbolic color, and pearl white is a symbolic color of lung cancer. The awareness month is November for lung cancer. And there's a need to create national awareness and eventually global awareness to break the stigma associated with lung cancer, because lung cancer is thought to be a condition of just smokers alone. And this awareness campaign is to make everybody aware that lung cancer can affect anybody, not just smokers. There is inadequate lung cancer research funding, and this is why there are a lot of unknown research questions in place as to how these genetic mutations, etc., actually influence lung cancer development. But what has been really wonderful and really a stride ahead has been the path-breaking research that has brought out very bespoke treatments for patients through genetic targeted therapy, which I will be talking a bit later on. And if we can eliminate those heavy costs and make them more cost-effective and more affordable, we will be able to reach out to a far greater number of patients and in this way save more lives, improve patient survival. And also in this way, we'll be able to give them the right to life and be more inclusive. So moving on to the facts of lung cancer. It's a myth to say that lung cancer affects just the elderly. Lung cancer can affect anybody. In fact, it is seen more prevalent in the younger population in present times. It can affect anybody. There's a famous sentence, if you have lungs, you can get lung cancer. And that is really true. The mortality associated with lung cancer is fairly high if left untreated. It's the greatest killer when you combine the deaths from breast, prostate, and colon cancer together. So you can imagine how serious this condition is. The incidence of breast cancer is the highest. However, lung cancer mortality is the greatest amongst all cancers in the world. So this calls for an urgent need for better treatment, improved survival rates, improved prognosis, and of course, early diagnosis, which would be the ideal solution. However, there are wonderful novel treatments that have come today, which is genetic targeted therapy, which is extremely mutation specific, and immunotherapy as well, which trains the immune system. So we all have this defense mechanism and immune system, and it trains the immune system to fight off the cancer and cause tumor necrosis. Moving on to the types of lung cancer. Lung cancer classification is incredibly complex, depending on the mutations, the expressions, etc. But I'm going to focus on just a simple classification. They are of two types, the non-small cell, which has a prevalence of about 80 to 85% in patients. And you have about 10 to 15% of patients presenting with small cell. Small cell is more aggressive and has two largely important subtypes, which is the small cell carcinoma, which is also the oat cell, and the small cell carcinoma combined, which is another type of very rare small cell lung cancer. You also have 4 different types depending on the mutations and so on, but I will not be focused on that for today's webinar. The non-small cell lung cancer type is got 3 different subtypes. The predominant one is adenocarcinoma, which affects 65% of lung cancer patients. It has a dominance in non-smokers. The squamous cell carcinoma is mainly seen in smokers. It can also be seen, very surprisingly, even in non-smokers, but the percentage is obviously very rare again. Large cell carcinoma is another type of abnormally large cells, which are of course cancerous, and they are present in just 10% of patients. So I'm focused again only on the subtype adenocarcinoma of non-small cell lung cancer. So moving on to the subtype of adenocarcinoma in non-smokers, this has a higher incidence in younger adults. It has a high incidence in women compared to men who are non-smokers and who are Asian in ethnicity. The trend seen is they are healthy, active, leading an absolutely normal lifestyle, and they are asymptomatic even at stage 4. So you can imagine how hard it is, probably harder than even a needle in a haystack, to diagnose the condition. It is seen in non-smokers that they are driven by genetic mutations which are present on an EGFR gene in these patients. These mutations are somatic in nature and are non-inheritable. So when I say that, it means that these are acquired over your lifetime, and they are not something that can be inherited or passed on via germline mutations as we know them, which can be inherited. So if you're a parent, you can't pass this on to an offspring. So moving on to what exactly is this EGFR mutation and how does it translate to non-small cell lung cancer? So the EGFR stands for an epidermal growth factor receptor. It is present in various cells in the body, practically all of them, in epithelial tissue mainly. Its function is to assist cell division, growth, and cell survival. It's a protein and it's encoded by the EGFR gene. Mutations in this gene tend to lead to an excess EGFR protein expression. You have different types of genetic mutations. So as I explained about the EGFR gene, this type of mutation is almost 80 to 85% seen in non-smokers of this particular adenocarcinoma subtype, as I explained. So you have different types like the ALK, which is a kinase mutation, the BRAF mutation, which is a very interesting mutation because this is one type of mutation which, although we think it is seen as a non-inheritable mutation, it can also be inherited. And there is actually a genetic test for BRAF mutation, so you can actually tell if you are carrying this gene and eventually, what is your chances of developing, non-small cell lung cancer. You have also a Ros One Mutation, which is a rearrangement mutation. Basically, this is a gene which tags on to another gene and forms a gene which is totally defective. It doesn't make much sense. So that causes this abnormal growth of cells and leads to a tumor and hence the lung cancer development. The KRAS mutation is also another complex mutation, but I will not be getting into that at present. But all these mutations, there is a lot of scope as genetic targeted therapy has just revolutionized lung cancer treatment. So moving on to the breakthrough therapy. So my focus is, of course, genetic targeted therapy. So it's very mutant selective. So depending on your mutation, you have to obviously undergo a genetic test for this. So depending on, you start off with an X-ray and then you have scans following. And then depending on where the tumor is, you have a biopsy. And from the biopsy, you can have a genetic test. And that tells you what type of gene mutations you actually have. So it's quite a fantastic procedure. And these genetic targeted therapies are mainly tyrosine kinase inhibitors. So most of us are familiar with TKIs and cancer. But the reason for these is that they are highly effective. They are mutant selective, so they leave behind the normal gene, and they target only the mutant gene. So all of us have, for example, in the EGFR domain, we all have the EGFR gene. And in patients who develop non-small cell lung cancer through the EGFR mutation, you need to somehow arrest the mutation whilst leaving the normal EGFR gene going. That's the ultimate target. So in this way, there are fewer side effects. It's less traumatic, unlike unlike numerous chemotherapy infusions. And of course, we do know that in the present time, there have been new treatments come up, for example, like oral chemotherapy pills, etc. But these genetic targeted therapies sound quite like rocket science, because imagine just popping it like a vitamin pill in the morning, just one. And you can just go on leading the lifestyle you already had, a normal lifestyle with no side effects. So it is quite commendable treatment for patients. It has really, really improved their prognosis. Some other ways of killing off the cancer is by arresting tumor angiogenesis, which basically means you cut off the blood supply to the tumor, because all cells, as we know, require blood supply for their survival and proliferation and growth. But in this case, by cutting off the blood supply, the tumor will just necrose and die off. And of course, the TKIs, the tyrosine kinase inhibitors, as I explained, these are first generation, second generation, third generation. And these generations depend on the line of treatment that you have. So if you have been on a particular drug, develop resistance, you move on to the second. Then when you develop resistance again, you move on to the third. So that's why these are called first, second, third. So I've listed, just a few names here, like the erlotinib, which is the first generation in the case of EGFR gene mutations, the afatinib, which is again the second generation one. So as patients started progressing from these, that's how the discovery has been made to try and target these breaches that the cancer does at each step. So osimertinib now is the only known third generation genetic targeted therapy at this stage. And it has been found that it is far more effective than any of the previous generations. And that is why it's an approved first line treatment for non-small cell lung cancer. Of course, you do have patients who are still on the older ones. And as they progress, they obviously have another hope coming up, like the afatinib or osimertinib, depending on their progression-free years. So as I said again, the EGFR mutation targeted therapies, they bind to these tumor pathways and cut off signal transduction, and meaning the signaling down from the gene. And in this way, you can just shut off irreversibly the tumor and just keep it silenced forever. So it's quite a commendable therapy. So moving on from there, cannot forget all the warriors we have. We can't just say only the patient group is a warrior. There are warriors in so many departments that all has led to this wonderful timeline to where we are in the treatment of lung cancer patients. So starting with the path-breaking research scientists who have found this novel candidate for this gene, which is of course of clinical relevance, the EGFR mutation. And having this targeted therapy for that as a pill is just really, truly wonderful. So a big thanks to them. And from there, the non-small cell lung cancer patients, of course, it is truly brave and such a wonderful platform to even come on to and be motivated to share your story with so many other people, either as caregiver or as a patient and as a living survivor. So it is fantastic, I would say. And to share your testimonial with various patients across the globe, including those who are newly diagnosed, even depending on age. There is so much going on, and these platforms create such a wonderful support group for these people and for all of us in general. Also, cannot forget devoted surgeons, oncologists, doctors, nurses, medical staff who have been in patient hospital care. I've been in this, for the last 1 year, since more than a year actually, since my mom's diagnosis, and it's been such a wonderful journey because at every step where I thought, okay, I don't know how I'm going to go forward, they were always there, no matter what, and they have been so, they have been truly supportive. And I think being grateful is just such a cliche word for me. I have just no words for that. So a big thanks to you. Thank you as well. It's too cliche. And then not forgetting all the non-small cell lung cancer patients who so bravely just sign up for new clinical trials. They have no idea that whether it's going to benefit them or not, but they just blindly trust all of us scientists. So we as scientists have a very major and critical role to play because we have a lot of lives that are on us, and we have to obviously test them out and see what is the level of efficacy, what is the dosage efficacy, etc. So it's really incredible, and a big thanks to all the non-small cell lung cancer patients who come forward for these clinical trials, because that's why we are here today with truly working genetic targeted therapies. So yes, so from here, in the case of non-small cell lung cancer, so what's the scope? Okay, if you're diagnosed at stage 1 or stage 2 or stage 3, stage 4, I must say there is just one word that summarizes it all. There is plenty of hope. So starting with the biopsy, I believe it's a multidisciplinary approach. So you have gene sequencing, and gene sequencing has really transformed the landscape of lung cancer treatment. So once you have a gene mutation, like the EGFR, for instance, then you're just put onto a genetic targeted therapy. And from that genetic targeted therapy, you can either be just on that, or depending on certain symptoms or progressions, etc., you can then have a combination of chemotherapy, surgery, immunotherapy, and radiation. So I personally feel that it's a combined approach, it's a collective approach. And by adopting this method, which is bespoke and tailor-made to each patient, based on each of their side effects, based on their diagnosis, by combining all these different methods together, the more novel genetic targeted therapy and immunotherapy, and along with the more traditional chemotherapy and radiation, along with surgery. And each time one progresses by doing a biopsy again, redoing the gene sequencing, and then depending on that mutation again, putting you onto various different or combination of genetic targeted therapies. All this together will definitely help in the effective management of non-small cell lung cancer. And at present, we don't have a cure, but it is definitely treatable. So we're not far away. It's not light years away, I believe, where we will actually find a cure towards non-small cell lung cancer. I'd like to end by saying the combination of resilience, miracles, hope, courage, faith, and strength. These are some of the attributes to all of our warriors. And this is a message to all of the lung cancer patients I've been engaged with all over the world. So a big thanks to all of you. And with the science, I'm sure we'd go really far. You've got this. So thank you so much for being on my platform, and feel free to ask me as a caregiver when I started out with my mom. And today, my own mom, a non-small cell lung cancer survivor, has joined me on this webinar. So she's here today, and you're free to ask questions to either me and her, or both of us. So thank you so much for being here and for your support. I mean, I'm really, truly appreciative. Thanks.
Can have the audience unmute themselves and get their doubts clarified.
For that, I would like to say a few words, Roy. Most people would be, sort of challenged with all this genetic mutation and targeted therapy and all that. I just want to tell them one thing. See, when I was diagnosed, I'm known to lead a fairly healthy lifestyle, a very simple lifestyle. Being a doctor in Mumbai for 35 years, nearly 35 years, I don't even own a car. I walk, take the public transport. So long as God has given me two legs, I decided I'll go the other way and be just one out of everybody, among the rest of the doctor community, to lead a very, very simple and normal lifestyle, just like everybody else. Now, for me to be told all of a sudden by the radio, and I look at the X-ray that I've taken, all because I had, what was my symptom? Nothing. Cough, well, I was known to have asthma since childhood. Not very bad, perhaps once or twice a year when everybody else gets a cough and a cold. I would also get a cough and a cold, but I needed a little bronchodilator, things like that. Maybe perhaps for about 5 or 6 days. The only, what shall I say, symptom that I had was this cough and cold. This bronchospasm didn't quite go away the year before last, in the year 2019, August. But that I attributed to the fact that I was running around a lot, walking, and there was no rest. I just had to do a lot of physical exercise. There was no other way. So it was there off and on, off and on. It didn't quite bother me till 2020, when the lockdown came up. I had thought to myself that I would do a complete health checkup on myself in the month of March, because I've never done a health checkup, ever in my life. So that's where I was, because I know that I don't have that blood pressure or diabetes, and being on a cardiac team and seeing over maybe perhaps 10,000 or 15,000 hearts, we know what blockages are about. I knew I didn't have that kind of a blockage. So it was a strange kind of a feeling. All that I can say is I was not feeling normal. Like I felt I was walking on a cloud. But today, at the end of 1 year, 4 months, whatever, I'm still on a cloud because the PET scan says, there's no evidence of disease. So where am I today? And where was I 1 year, 4 months ago? I didn't panic when I was forced into this X-ray by my daughter, Philomena, and my husband. All because that one particular day I didn't have an appetite. Okay, let's go for the X-ray next day. Or rather, perhaps my hemoglobin is low. My hemoglobin was 13, serum creatinine was 0.9, and it wanted a 2D echo to be done on. But it wasn't possible. The doctor was not available, or being the pandemic time. So I said, okay, I'll take the X-ray and I'll see the size of my heart. The heart looks absolutely normal. The rest of my lung fields were very good. I looked at the bases to see whether I had effects of asthma. That also wasn't there. So I was quite delighted. Then I happened to glance above the arch of the aorta and I see this huge, big mass, huge, very huge. And I knew there was a major problem. So that's how it started. And from there, the ball kept rolling. But it was as if the hospital was tailor-made for me. I didn't have to wait in queue. In 4 hours' time, I had a PET scan taken, and in 24 hours' time, there was a biopsy taken. And 5 days later, the diagnosis in hand, which I can't imagine how it could have, this have been possible at any other time. It's only because of the pandemic. And to be told that you have a stage 4 lung cancer, I just looked back at the radiologist that day, the first day when the X-ray was taken, because he also didn't believe it, and neither did I. So we looked at each other, then I said, okay, being a doctor, we've seen know what life and death is about, but with this pandemic since last year, everybody has seen that. And there's no denying that, you see, you would just wonder, I mean, today it's you, tomorrow it may be me with this pandemic. Anybody could have got the COVID. And there have been people, families have lost several members in their families, and at very young ages, all kinds. So when people were dying like that, you're there today and gone tomorrow. Cancer was just, second in line to that. I mean, it was far away. I knew that I would go. But I thought to myself, how many days or how many weeks do I have? That was my understanding of stage 4 lung cancer. First thing I said to my family, look, I'm not going to take this chemotherapy, so that will finish me off faster than the disease. Let me die peacefully in the comfort of my home. But whatever I want to do, and just leave me to do whatever I would like to do. I would like to tell everybody about it, talk to all my friends across the globe, and that's how it started. But as the days progressed and the diagnosis came on within 5 days' time, and I was told that I would not require the standard chemotherapy, all I would need is a proper tablet. And okay, I'll take it. So that's how it went. Something quite unbelievable, because when we studied medicine, say 40 years ago, we didn't know anything about this non-small cell and this gene targeting and the whole works. Today, everything has changed so much in the last 15 years or 20 years. The complete treatment of cancer as such, even in other types of cancers. And lung cancer in women and non-smokers is almost unheard, at least to me. Never heard of women who are non-smoking and leading a healthy lifestyle to be diagnosed with lung cancer, and they say that you're stage 4 and I have no symptoms, apart from the fact that I said I felt like I was walking on a cloud. That's all. Even my weight had increased because I was made to eat. I was forced to eat. My hemoglobin was 13 grams. So, where did this cancer come from? I didn't ask, and say, oh, why did it happen to me, and why me, and why not, things like that. No, I said, okay, we've got to accept it. Once you cross 60, age of 60, you've got to go one way or the other. So if it's cancer, it's cancer. I mean, you've got to accept it. So that was my way of looking at it. I never shed a tear or felt depressed but I said, okay, we have to be positive about it. So I've always been positive right from the start, and always smiled about it and joked about it. That's what I wanted to share with you. So it's not something that people start panicking and weeping and crying and they get depressed. No. You have to have faith and move on. Take each day as it comes. After all, nothing is permanent in this on this planet, isn't there? Everyone has learned that from the pandemic. So it's like that.
And I'd like to vouch for that as Rita's friend, that vouch for this positive attitude. It was fantastic how she took it all. It was unbelievable, in fact. I mean, I never saw her, never heard her rather, because we were always talking on the phone. I never met her at that point of time. But she was so positive right through. I never heard her be depressed or say anything. No shedding of tears and not saying anything negative. It was very inspiring. So that is what yeah.
Yes, thanks, Rivi Auntie. That's so sweet. I think that's where it became a tougher journey for me, because there was no one to console with, to find any support of consolation. So I had to sort of console myself. I think it's a very different ball game when you have, you're diagnosed, it drops like a bombshell like that. And mom just says, it's all right. It's just a bit crazy.
This is amazing.
Like, wow. So it was quite inspiring. I think inspiring is the right word. Yes, you're absolutely right. And I think our main task now is to meet so many people, all of you and the unknown as well, who have just been part of this journey with me. I'm just truly grateful for it, because just at any time of the night or the day, I could just talk to people if I wanted to. And it was so lovely for so many of you opening up your homes for me as well. So for me, it's always going to be something that has been of a kind of a fortress for me, of fortitude. So I just don't know how I will ever repay all this.
Oh boy.
The message for everybody else is this: lung cancer can affect just about anybody. You don't have to keep thinking, oh, am I going to get it today? Am I going to get it tomorrow? But it's there, and it cannot be diagnosed. There is no screening procedure for this in the early stages, in stage 1 and stage 2. There is no screen. Even the X-ray will not pick it up. So I used to think to myself, well, everybody does health checkups every year, every 2 years. I keep doing it. I've never done it ever in my life. So even had I done an X-ray, say 2 years ago, it wouldn't have picked it up. That's the thing. So invariably, about 70% of lung cancers, non-small cell lung cancers in women, I'm talking about the women, get picked up only in stage 3, stage 4. And I had a bone lesion. It was so small, it couldn't be picked up on the CT scan. So when the surgeon insisted that he wanted a biopsy even of that lesion, bone lesion of the lymph nodes, the radiologist panicked. He says the bone lesion is not visible on the CT scan. So when you have to do a CT guided biopsy, how would I take this lesion? How would I biopsy this? It's not possible. And as for the lymph nodes, they were there all over, but he says they were small and I might create a, he said he felt he might have created a complication trying to target all those, biopsy each of those lymph nodes. So he was in quite a flap, but he managed to take all the bits that he wanted to from the main tumor. That gave the diagnosis very straightforward. Then, of course, the MRI of the brain also was done. If there are secondaries to the brain, that also was not there.
Yes, one important point I wanted to mention was this osimertinib, third generation genetic targeted drug. It is actually a drug that prevents brain mets from happening. So that's why it has been approved as a first line one as well, because it's the only one, I think, along with the second generation afatinib I mentioned, but it's the osimertinib which has the best effect on this, on the brain. So it prevents crossing into the CNS. Yeah.
It crosses the blood-brain barrier into the brain and targets all the metastases in the brain, if there is.
Yes. It prevents the cancer cells from crossing in.
That's what the message is, that the lung cancer can't affect anybody, whether smokers or non-smokers. It's the myth that only smokers can get cancer. No. I'm not young, but the young ones, like in their 30s and 40s, they also have been known to have diagnosed to have a non-small cell lung cancer. Illumina has a huge battalion of patients across the globe, all age groups, and they have been following up.
Yes, the youngest I got to know was only I heard of was 25 recently, and also 15. So I was very surprised that there's this trend even being seen in young adolescent people. It's like, wow, oh my goodness. Okay, so but it's being seen that it's highly prevalent with this EGFR mutation, this epidermal growth factor mutation. So the question is why this is happening, and that too, it's not even something inherited. It's just acquired over your lifetime. So one theory is you just accumulate some genetic changes all through, because we all have checkpoint mechanisms which suppress, any abnormal mutations happening. We all have these checkpoint systems. But if there's an imbalance between, for instance, the proto-oncogenes which develop into cancer and the tumor suppressors which suppress this growth, then they will obviously cause an abnormal cell, there won't be any cell death. There'll just be a constant cell growth, like as if you press your foot on a gas pedal in a car and it just keeps on and on going. There's no regulatory factor. So so that is one of the that's one of the theories, but again, it's very difficult to work out why it's happening. The question of why is still the question mark.
There have been several patients who were diagnosed at stage 4. This is at least 11, 13 years ago. Diagnosed at stage 4, operated for the lesion, even for the bone lesion, and was on targeted therapy for 3 years. And today, at the end of 13 years, is not on treatment at all since at least 9 years. So each patient behaves differently. There is no standard that stage 3, you're stage 3 or stage 4, and that's the end for you, or you're stage 1, and oh, you're very early. The stage 1 can go into stage 4 in 20 days' time. So there is no really standard that the stage 1 treated like the stage 2 treated like that. So you could be found at any stage, and each one responds in a different way.
Yeah, now they have found that, the earlier the stage, the more easier it is to treat, of course, because then if you have so many mets, then they have to work out which part of the body to target first. Do you start with chemo, then radiation, and then surgery doesn't become an alternative because it's too much everywhere. But what I want to also mention very importantly is it's no longer known that at stage 4, you're not a surgical candidate anymore. Because if you're a patient who has benefited from all these different therapies I mentioned, like immunotherapy or genetic therapy and radiation, and now you have just one single tumor or a small mass left, which is still acting resistant. As funny as it sounds, if you surgically remove this, you're indirectly reducing the tumor load, and you can, of course, help in a progression-free survival again. So it's all about effectively managing, because we all know cancer is something that tries to breach various barriers. So if you try to stop it from one pathway, it will try to find another pathway. So as I mentioned, that's why you have these different generation or first line, second line treatments going on. But it's very important that there's no such thing as if you're stage 4, there's no scope at all. There's plenty of hope out there. And it's a combination of all the traditional versus the novel methods, which will basically effectively improve one's survival. And also you can just lead normal lives. I mean, mom is just back to where she has always been. There's no difference.
That is the operation theater. It's my cardiac team, yes.
So so that's where we are. It's when you start off, it was such a short lifespan, and then now you realize there's a whole new lease of life. So I strongly believe it's a combination of miracles and faith in whatever you believe in, whether you're spiritual or not, along with, of course, the science behind it. So it's a perfect combination of that. And most importantly, most of us might have heard, but it's also a positive attitude, which really gets you going.
And when people look at me, and most people, in Hinduja, so how the word spreads, oh, she has got cancer. So many people didn't even know I had it. So I said, you know what I went through, right?
Yeah.
So, oh, don't tell me, it was COVID. They all think it's COVID. I said, no, COVID. They said, adenocarcinoma of the lung. So they look at me and say, so I tell them, I tell everybody, even unknown people, that look, I was stage 4 adenocarcinoma of the lung 1.5 years ago, and today here I am. So don't give up hope. So even those with cancers, other cancers, I tell them, don't give up hope. Lots of new things have happened today, happening today with this breakthrough in genes and genetic therapy, immunotherapy. But tomorrow, perhaps in the next few decades, when you come to a doctor, they're not going to examine you with a stethoscope. They'll just take a sample of your blood and put it through a gene sequencing and tell you, you've got this, and you're likely to get this, and this, something like that. So all this kind of clinical testing will be all obsolete in the coming generations.
Yeah, with this artificial intelligence and computer science is advancing.
Yeah.
Yes.
Yeah.
What you said is just a day away, like kind of.
And even doctors today are not aware of my generation, doctors of my generation and later, because we all studied medicine 40, 45, 50 years ago. So are not aware of lung cancer in women, non-smoking women. Breast cancer, yes, everybody knows about breast cancer. They go for breast cancer screening, checkups, all that. Lung cancer, there isn't any screening mechanism for that. There's no screening test for early lung cancer. But during this pandemic, because everybody went through CT scans, for suspected COVID, many cases of lung cancer have been picked up. Early cases of lung cancer have been picked up.
One tea? Huh?
Hello, I wanted to ask you a question.
Yes, of course.
Since you say the etiology is not really known and it is detected mostly in stage 4, then at what age now youngsters are also getting this lung cancer? So should any investigation be done like at a particular period of time, say every 5 years, and then those who are in their 60s, should they really do it every yearly or 2 yearly? And suppose you have suffered from COVID I know it's a long question. Suffered from
No, we're following you. Perfect. Keep going.
Yeah.
Keep going.
Suffered from COVID, which was pretty severe, since the HRCT scan showed that there was pneumonic patch COVID-19 this thing. So is it necessary to repeat a CT scan? Is it probably possible that anybody who has suffered from severe COVID infection is likely to get lung cancer?
It's very hard to say because it's as I said, like in mom's case, for instance, she was an asthmatic.
Okay.
So she was on and off, and even I had seen she took a little bit of extra inhaler puffs and she was fine. She just got okay. So it was masking something more sinister. It's quite scary when you think about it, but it's very hard to pinpoint how to work out whether it's a lung cancer lesion or whether you actually have this thing. So I suppose now after hearing, people will start getting more serious about it and think, as you said, maybe go again for another screening. But that's the only way to tell whether you probably have something. But again, how to detect it in the early stages, again, depends on the radiologist as well, how clever they are to, actually diagnose that in the smallest of stage, in the smallest of masses that they might be at stage 1.
But just an X-ray test. Suppose a patient is suffering from bronchial asthma since a long time, over a long period of time. Would an X-ray test, because X-ray test is a really very rough estimate.
Yeah.
X-ray test really show anything, or is it a PET scan or CT scan? Or
you have to keep doing PET scans, and
you're right. You're right about the PET scan. Yes.
Okay.
Then you can't really do PET scans for everybody, as a screening test. A PET scan, it's too much to put you through.
It's a very high radiation scan as well. So
exactly.
Unless you, sorry, Clara. Yes.
Suppose somebody is suffering with bronchial asthma over a very long period of time. So is it necessary to advise that person go for
No,
a PET?
No, not at all.
Not really. That was why it was very unusual. I just told mom, I just said, Mom, please just do that for me. It might not be anything, just do it. But that's the thing. That's how it drops as a bombshell, because even I didn't ever suspect it's going to be something like that.
Okay. Other than bronchial asthma, she didn't have any other.
And this asthma Clara was not, like every day because I was so conscious about my lung capacity. I've been exercising. I'm very particular about this exercising and increasing lung capacity and all that. So this asthma was probably just, as I told you this, as I say, it was like a bronchospasm, maybe 5-6 days in the whole year, when everybody else gets a cough and a cold.
You were on dilators constantly, or
no, not at all. I said 5 to 6 days in the whole year. I was on an inhaler puff only for 5 or 6 days in a year.
All right. Okay.
So that's the thing about this particular subtype in non-smokers. It just doesn't have any symptoms. Some people might be lucky to have them, but mostly it is just asymptomatic. So that is why it is so
very late.
Yeah, the need to find the research behind it and work out how to have a screening protocol is so much needed at this point of time.
Yeah,
but my way of working it out is, I don't think we should focus on the early screening part. Rather, whatever stage you might come in, even at stage 4, it's better to find more effective treatments to manage it, and actually find a cure, rather than focus on just a screening part. Because many people have, like for example, in the UK, I heard of a lot of cases where lung cancer was just missed. So they were so busy with the COVID crisis that they just left out all the.
All over the world, actually, lung cancer is almost always detected when it is really too late.
Yes. But really? Of course, it's not their fault completely too, because you're right. The symptoms don't, because for example, if you have, like how mom said towards the end, she just suddenly realized, hey, why do I not want my dinner? And that's just an arbitrary feeling of maybe I should do something about it. But it just came in 1 or 2 days like that. So without any warning. So it's quite a silent way of coming in, so there is no...
there was loss of appetite. What actually made you ask her to take a PET scan?
No, not PET scan. She didn't ask me. An X-ray, chest X-ray.
X-ray.
And the thing is, because of the COVID season,
All right.
all the big hospitals, including Hinduja, they said, unless you are suspect for COVID, please don't come to the hospital for any investigations. You might pick up a COVID in the hospital because everybody was coming to the, to the outpatient is COVID, or for investigation. So unless you have a letter from your doctor saying that you're suspected COVID, do not come for an X-ray.
Exactly.
So that's the only one she wanted. And I never in my wildest dreams imagined that there'd be anything wrong with my chest, with my lungs. I thought perhaps because of my age, I might perhaps have a aortic valve problem. That's why I'm feeling like I'm walking on a cloud. There's not enough blood going to my brain, that kind of a feeling.
Okay.
So I took a stethoscope, auscultated myself, couldn't hear any murmurs, even auscultated my carotids. There's no thrill. I kept thinking it's quite normal. But I was just aware of that something is, why am I not feeling I was aware of my breathing, shall I say. So at night, I would insist that the windows are open, there's enough ventilation in the room, like that. So that was, and in the morning I'd wake up and as I'm brushing my teeth, look at myself in the mirror, look at, whether I have these muscles working excessively because I'm breathing excessively, or what I checked my respiratory rate. I did all the, physical examination on myself and everything was normal, absolutely normal. I said, then what's wrong? But it must be an aortic valve problem. So I'll have a 2D echo done. These people are insisting on X-ray, they're missing the boat. I've got a valve problem. And, that's what it is. Or maybe Christina suggested your hemoglobin must be low. That also is a possibility. My husband says, you don't eat breakfast. I says, I can't have more than a glass of milk in the morning. I'm not used to having breakfast. All these decades I've not had breakfast. I don't feel hungry in the morning. So I said, okay,
Yes,
so I forced myself. So I said,
Yes.
they, made that extra cheese sandwich, a toast and egg and everything. So for a month I was doing that. So as a result of which, when I went for the PET scan, when the radiologist checked my weight, I was 59 kilos. So I said, I've gained 2 kilos. I was always around 57. So all this extra food has made me gain some weight. So it can't possibly be anything sinister anyway. And after seeing the X-ray, all my colleagues, my cardiac colleagues, they said, see, you are one of the healthiest individuals walking about and leading a very normal lifestyle, no stress, nothing. So this is probably a benign tumor. It may be a neurofibroma or one of those, lipoma, one of those mediastinal tumors. Doesn't even appear to be in the lung. So not to worry. So I was quite, what should I say? I was taken up with that. I too felt it was the same way. There can't be anything sinister. I've gained weight. My hemoglobin is 13 grams that morning done at the hospital.
Okay.
So what could it be? So to be told, the radiologist, when the PET scan, he says, no, we'll have to do a PET scan because we won't do the CT scan, he says, because you have this allergic kind of a diagnosis. So we will do directly a PET scan because anyway, we'll have to do a CT scan to do a biopsy. So let's do the PET scan. So within a matter of 4 hours from the X-ray, I had the PET scan done.
Okay.
Without an appointment in the hospital because, all the departments were free. So he did the PET scan and he got the shock of his life. And he came back to, I insisted, and I want to know what he found on it. And they said, no, you've got all this the radioactive stuff in your body, so the doctor will not see you, the nurse. I said, no, I want to speak to him, so let him speak to me on the phone. But he came charging in, stood in front of me, and he said, are you a smoker? I said, you've got to be joking. These were my words. He said, well, you have advanced lung cancer, stage 4, with mets everywhere. I said, oh, I see. Where all? And he said, even in the bone. I said, which bone? He said, in the left bone. I said, I see. So what's the next step? So we both stared at each other like that. He was with the mask, I was without, and then looked at him and said, what's the next step? He said, it will be the biopsy. I said, could you do it just now? He says, no, tomorrow after all the bleeding parameters are done. That's how I was very afraid of the blood, of the biopsy, because I have a very low threshold for pain. So that is when I panicked. I said, if he said nothing to be done and he just started, I would have probably just gone home and, quietly died at home, just watched for the various things.
Nothing was there, no pain at all. And what was the biopsy? It was
no, the biopsy, yes, I was very afraid of the biopsy because I didn't realize how sinister a lung biopsy can be. And just between a radiologist and me, without an intervening physician seeing me, all my friends were aghast. They says, no, you can't just do that. I mean, somebody has to be responsible for you. What if you have a complication on the tip? That's when I realized. The whole night I talked to my friends literally across the globe, all my classmates. I'm from CMC Vellore, so I had a huge panel of people advising me. So then I, contacted the doctor I was really looking for. That was Dr. Raman Deshpande. He's one of the biggest names, and I've known him on a personal level. So I think that's the only time I ever cried. I said, Raman, I said, I'm terrified of this thing. I'm going to cancel this PET scan and come across and meet you. You tell me what to do. He says, no. Coming and meeting me is not a question. I'll speak to the person concerned, and you have that, the CT scan guided biopsy. So he spoke to them, and they calmed me down because I was terrified with the biopsy that I might die on the operating table. I said, yes, I know I have a stage 4. I will die in time. It may be a few weeks, perhaps. You pull on, even with a very, very advanced disease, you can pull on for a few weeks, but not to die on the operating table. I was prepared to die in 24 hours on the table. So that was my fear. But then I said, you give me GA into it, but they were even more frightened. Because GA means you might require a ventilator. What if you don't wake up after the biopsy? But the radiologist was extremely good, which is at Nanavati Hospital. It's extremely good. And he said, I will go very, very slowly. Do not panic. They had an anesthetist standby. They had all the precautionary things ready for me, and calmed me down, got my heart rate down. My blood pressure had shot up because the systolic had shot up, he said, because of the anxiety.
Okay.
Everything was back to normal. In 5 minutes, I settled down. It was just prayed. I said, okay. And we went through the biopsy.
Which helped a lot, yes. Definitely.
Yeah. So I didn't feel any pain. But I did go through, after 1 year of targeted therapy, or 10 months, I went through a surgery for that primary tumor in the lung. Everything else had regressed. Only that tumor in the lung, the main tumor, which has shrunk considerably, had again marginally started to increase activity. So that was removed by the surgeon.
Even in stage 4, no secondaries had developed anywhere.
No, so all the secondaries had regressed within 3 weeks of treatment with targeted therapy last year. So everything else, including the bone, everything had gone down.
Hi, Philomena.
Yes, hi.
Hi, Ofri. This is Marina here.
Hi, Marina. Hi.
I'm not Ofri, actually, I'm Rita. My name is Rita. Ofri is my husband. So I'm coming on his,
okay.
It's on
Sorry.
his laptop. That's all right.
Hi, Rita.
Hi,
this is Marina here. And, I've got a friend of mine
Yeah.
who has lung cancer.
Yeah.
And right now he's on the move. And I want him to ask you a few questions. And maybe you could encourage him,
Of course,
after all that you've been through.
Yeah.
So, Jeru, please
yes.
ask your questions now. Hello.
Hello.
Is he here?
Yeah, he's here. Jeru, please unmute your mic, and I want you to ask her whatever doubts or questions that you have. Let me check.
How old is he? Sorry.
I don't know, but he's above 60.
Okay, I'm 60. I'm going to be 66 at the end of this month.
Jeru, you'll have to unmute your mic. You'll have to, press your mic, unmute. Just unmute the mic and you'll be able to talk. Jeru, let me send him a message. Maybe he can't hear.
Sure, not a problem.
Because I called him here because I wanted him to clear his doubts and ask you a few questions. In the meantime, whoever wants can ask.
Yes, of course, we're here. You're free to ask whatever you want, either scientifically or medically.
I'll tell you from the physicians and the surgeons and the patient's point of view.
Yes. I've always had a very interesting question for my mom, actually. Being a surgeon all her life with all these patients and having seen her, what was the ordeal she put me through for an brain MRI, which is a simple scan of the brain. How did it feel for you to take that role as a patient? From a surgeon, you're now
terrible.
a patient yourself.
It was a terrible patient, I'm sure. Because the MRI, it blew my brain out. In the sense that I was so claustrophobic in that machine, the first time being put through any kind of investigation, it was terrifying. Then I shut my eyes and got them to, have the anesthetist stand by with me. So the first time I pressed the alarm buttons, to come out of the machine. I couldn't take it.
बाल्टी
Not for
किधर
the
है?
sound. It's
हाँ,
very
बाल्टी
frightening. The MRI was very frightening.
बाल्टी
experience.
तो दिया हाँ ले इधर
But apart from that, everything else was fine. Went through it. But I don't like being a patient. Nobody likes being a patient.
Yes, but still, you did make a great patient, I thought, despite the saying, surgeons are the best, doctors are the worst patients. But I think
Especially surgeons. And that, I gave the surgical team quite a, I think, a handful, because I'm sensitive to pain, extremely sensitive to pain. I have a very low threshold for pain. So that was my only worry after the surgery, how much pain would I have? That can drop my blood pressure a lot. As it is, I have a lower systolic blood pressure.
I think we have the gentleman on board now.
Yes, please.
sure.
Hello. Hello, I'm Jerome Dicosta.
Yes, hi, Jerome.
Yeah, I'm diagnosed for cancer of the lung 4 months back. And they cannot give me any chemo. It is in the 4th stage. They gave me chemo once, but then my hemoglobin all went down. So they said they cannot do anything. Now they're giving me injection once in a month for the bones.
Right.
Yeah. And my right shoulder is paining a lot. I don't know why. It's troubling over there, the right shoulder.
Who is treating you, Jeremy? Sorry? Who is treating you? Where are you being treated?
GMC, Goa.
Ah, you're in Goa. Okay.
Yeah,
Okay.
Dr. Anupur Borkar. So they're giving me an injection once a month.
So we need to know more of your, your genetic background, the testing that they did for you, and perhaps if we have more information about your investigation, I'd be able to advise you.
Right.
Yeah, because it's not this lung cancer treatment is not just chemotherapy or radiation. There's so many more things to.
What about the targeted therapy? Did they offer you targeted therapy?
No, nothing.
Were you a smoker?
I gave up about 20 years back.
That should be okay.
Yes, no, but 20 years, 15 to 20 years ago is almost, they say, is equivalent to a non-smoker. So it would have been nice if if you had a genetic report, Geronio.
Yeah. And is it possible do you have anybody in Bombay? Could you come to Bombay?
Well, I can get that for you from him.
Yeah.
And I can forward the reports to you.
Yeah.
Yes, of course, that'll be helpful because if we have supposing there's a gene mutation, you can really benefit incredibly from the targeted therapy approach. So, and then depending on that, you combine it with all the various other methods I was saying earlier, like immunotherapy, chemotherapy, radiation, and even surgery. So depending on how, because the more mets you have, the more difficult it is from a surgical perspective. So they use all these other methods to get control of the cancer, and then whatever mass is left, the smaller it is, the more easier to remove. So you have such minimal invasive surgery in today's times, with mini VATs and things like that, video assisted surgery. So it's more or less a preserved lung function. You don't have to worry about losing an organ anymore. So there's a far better prognosis for surgery as well. So there's nothing to fear, basically, because when you say surgery, people are like, oh my gosh, but it's really literally like laparoscopic surgery, so minute and small for a lung. So there's nothing to worry about that either.
No, as a stage 4 lung cancer, we've been told we need to know how much you progressed from there, and when was this died? You say 4 months ago. So what did they do for you for 4 months? Yeah, you'll have to take it from there. So if you could send your reports, the latest reports, to Bombay, it would be helpful, because all the experts are here. We have a lot of internationally renowned experts in Bombay.
Yeah, honestly, I thought when mom had stage 4, came with the diagnosis and she told me she's not going to do anything. I knew, because being from a genetic background myself, I knew there was plenty of scope. But I thought to myself, do we have to somehow put everything and fly her to MSK Sloan Kettering, which is in the US? It's the #1 cancer center in the world, basically doing groundbreaking research every day. And I thought to myself, is that what the journey I've unraveled for my mom? This is just so unfair, I thought. But I said, well, that's it. We got to do it if that's what it is. And then I suddenly was researching around and I thought, you got to be joking. The seat and the heart of so much pioneering work is going on in the city I was actually staying in during the pandemic, in Mumbai, or Bombay as we know it. So I had a totally different approach to Bombay from that day, because the kind of treatment and the care, everything was just so streamlined and so wonderful. And some of them we didn't even know personally, so it was just incredible.
Whatever you get abroad, whatever is done abroad, you can get it done in Bombay. Everything is available in Bombay, believe me. You don't have to go to school.
And with a pandemic, we all know in India how the pandemic just took what a turn from the start, right from the start in 2020. But to still have all the cancer cases going, all the surgeries happening, India just makes it work somehow. So it was really something for me. I always find India's determination to bounce back just incredible. I've never seen that anywhere else. So it is something that needs to be written in the books, I believe. It's always something quite magical how that happens.
We'll certainly try to help you out.
Okay.
We'll help you.
Okay, I will send the reports.
Please.
Yeah.
I will send the reports to Marina.
Geronimo will send it to Marina, and Marina, I will give you the contacts of Rita.
Okay,
You can contact me.
okay.
You can contact.
Yeah.
Sure.
Yeah, I'll
Sure.
do that.
Okay,
Yeah.
just try to help him out and encourage
I will.
him.
Definitely.
He's
Because,
already on the path of recovery.
Yes.
Thanks
Of
a lot.
course, every single
And everybody's
cancer
prayers
patient-
are also there for him, everybody's prayers.
Yes.
Of course.
Yes,
Yeah.
indeed. And every lung cancer patient is incredibly important to me, so every single one of them is important. I can't afford to have anyone saying that, okay, I'm not sure what to do next. There is hope. You have got this. So you have to take that on board and take on all the bravery and courage you have and just get through it. Because as I said, when mom started out in June and then in October this year, so it's a little more than a year and a half, almost a year and a half, to be given those words, NED, no evidence of disease, it means it's just something so truly rewarding at the end of this whole journey. So for me, it's just, I don't know what to say. I have no words all the time. But I have to somehow convey all my emotions and what I'm really feeling to you in some way to give you a pathway of inspiration. So that if whoever, in fact, who has been met with this diagnosis, it is a seriously challenging condition, but it can be effectively managed with all that we have. And it's no longer old methods of just a hit and miss chemo versus radiation. There is bespoke targeted therapy which just targets only the abnormally growing cells and keeping all the normal, or in scientific terms, as we know, wild type, perfectly all right. So I think that is really incredible, isn't it? Because you wouldn't want all the normal cells dying as well, what chemotherapy normally does. So yes, so just don't be afraid of anything. There's plenty of hope, plenty of hope.
I've been through chemotherapy too, and those monthly injections and 3 weekly injections, so I know what you're talking about.
Hello, doctor. In which hospital did mom take treatment?
I'll tell you. I was at. I had my chemotherapy. That adjuvant chemotherapy was in this injectable thing this year for 4 sessions in Hinduja after the surgery.
And surgery?
Surgery I had at Kambala Hill. Dr. Ramakant Deshpande at Kambala Hill. He's an
what
oncosurgeon.
Deshpande? Which Deshpande?
Ramakant Deshpande.
Ramakant.
He's not a cardiac surgeon. No? Ramakant Deshpande is the onco-surgeon. So we know him as Raman Deshpande. Yes. He's one of the robotic surgeons.
Okay.
Leading
Thank
robotic surgeons in Bombay.
Thank you very
Thank
much.
you so much, Rita. Thank
you're
you,
welcome.
Dr.
No, most
Rita.
welcome.
We could
Not
put
at
you onto
all.
our teams. No?
I'll
We
keep
could
in
put
touch with you,
Please
okay?
do that. You're most welcome.
Yeah,
Anytime.
thank you.
Thanks a lot.
Thank you. Most welcome.
Do we have any more questions from the audience? Any sharing? Anybody wants to share some information?
Yeah, I want to share something.
Yeah.
My dad was a lung patient, a lung cancer patient. And actually, he was a heavy smoker. He was a chain smoker. And he had this terrible cough. And we all thought he's getting this cough because of his smoking. You know, and he was such a person who would never go to a doctor. He was staying in Goa and we were all here in Bombay. So he tried his own local medicine, you know, taking ginger juice and all that. And he used to drive. He was 80 years old. And one day he went to the market and suddenly he got, like, you know, his left hand just went numb. So somehow he managed to come home. And then when he went to the doctor, they realized it was lung cancer, which had traveled to his brain. And it was too late. The doctor said they couldn't do anything. Since his age was 80 years, they didn't want to do the chemotherapy also. Doctor just gave him 1 month. And that was it.
How many years ago was this?
It was, I think, 6 or 7 years back.
Yeah, that's strange as it sounds. That's quite a long time ago, because all this novel, that's what makes me very sad, because all this novel bespoke therapy has come out only since, in fact, the third generation one I was talking about earlier in my presentation, it has come out only in 2015, 2017. It got approved around that time, 2016, 2017. Okay. And at least in India, it came down only in 2017. So it's been around for hardly 2 years in India. So, you know, people feel that, that's why I say don't look at survival rates of lung cancer, because that has changed dramatically from all those survival rates are based on, you know, chemotherapy, radiation, but with the bespoke therapy, there comes a completely different survival rate. And because it's so bespoke, some patients unfortunately do progress very quickly. So I did learn of some patients where they started off with the third generation osimertinib back in the US, who I was in touch with, and they progressed within 4 months. They were quite upset about it, but there are lots of clinical trials that they have been signed up on. So some of them are still doing really well. The side effects are a little more depending, because, you know, you don't have a dosage safety. So it's about tweaking it and working out what is the, you know, optimal dose that you can take of this particular ingredient that they have. So that is the reason why I think advocation is so important, because it just makes me very sad that, you know, there are patients who are out there and then they've just gone. But at that point of time, some of these approaches have been so new, or they may have not even existed. So that's been the problem, really. So yeah, it's very sad to hear that. But maybe at that time, you know, there was no, as far as I do know, there was no genetic testing that could be done, you know, that long ago, even though it doesn't sound so long ago, just 6 or 7 years ago. So that's been the issue.
Other point to note is the younger the patient is, the better they tolerate these genetic targeted drugs, because you don't have any other comorbidities like blood pressure, diabetes, heart problems. So if they're younger, they respond much better. I'm on the older side, but because I didn't have the comorbidities, the oncologist, even before the biopsy was done, I called him up at Hinduja and I said, look, I keep coming to you and sending you patients, you know, other members of my family. Now it's for myself. Now, what do I do with this huge mass in the lung? And they're telling me to do a biopsy tomorrow. He says, no, I'll tell you what you'll have. You are active. He knows me as an active, alert, individual running about, climbing up and down the stairs and things like that. He says, for you, you're a woman, Asian, and without any comorbidities, all you will have an adenocarcinoma, and you will be EGFR positive. You won't even require chemotherapy. All you require is one tablet that you pop every day. That's exactly what he told me even before the biopsy was done. And this is on the 18th of June last year. It turned out to be exactly like that. Because he sees so many of them, the oncologist in India. That is Dr. Sachin Almin, Junior, the head of department there now.
And what's also interesting is some patients, for example, they thought, okay, now that we're on the third generation, so then if there's no fourth or fifth or sixth or whatever is coming up, then what do we do? And the thing is, it's so strange because some patients, for instance, have progressed on the third generation, and then they've waited a short period of time, a few months, with chemotherapy, radiation, gone on to various other things to control the progression. And then they have re-challenged them with the actual, the same drug. And actually they found them that they've just continued on, it's just about constantly challenging the tumor environment as well. That's what I believe, because it's just a whole mixture of everything. So that's why everything is so tailor-made. It has to be tailor-made, and not just the doctor. The doctor can't do anything without the patient coming forward and actually sharing all their symptoms, side effects. That's how they can move forward from that. So it's a great help, because that's how we know that these kind of approaches can be made. So it's not the end of the world if you just see a slight progression and you think, oh well, it's not working out for me. But some patients it's very much there in the research that you can re-challenge them with the same drug after a short span of time, or just sort of piggyback on one of the old chemotherapies or radiation in varied stages, different time points, and yeah, it works. So that's the crazy part as well. So in fact, for me as a genetic scientist, I find that very bizarre, because I always think that if you progress and that's it, you can't go further on. But actually it isn't, because from all these living testimonials I've been made part of, there is something like this, and it really does work. But what's very important is the time, the time factor. You don't just wait on and just think that, I'll just wait and see. That approach, I think, is not the way to go. So, it's better to target it as aggressively as possible in the beginning, and then you see how you can put forward, how you can go forward from there. So Mom started out with the third generation drug, and then sometime nearly a year later, about 9 months into it, she had a slight progression. It was a marginal one. So some opinions were, we just sit around and wait and see. Yeah, you can take that approach, because it might be nothing. It could be just a one-off thing, and you can just continue on it. But to surgically remove the burden in research has shown that if a tumor can be taken out by surgery, then you reduce the tumor load, and it does have a lot of better chances of moving forward, progression free. And I think that's what happened, because April, she had the surgery. Then she went on to 4 cycles of chemotherapy, all of which I was part of. So I know each and every step of that. And she was really brave, very courageous, and it was incredible, because the one problem was needles for my mom, not the chemotherapy, but the needle. So it was, I said, you're not even worried about the cytotoxicity, meaning being toxic to cells, and you have all this in your body. That doesn't scare you. She said, no. But what is it? It's the needle. And I realized that, because when I was there in the hospital, it was an absolute ordeal again, because I would sit there and try to be as supportive as possible and distract her when the nurse was giving a needle. And I had quite a lot of confusion, because I thought to myself, Mom has been a vascular surgeon on a heart surgery team, done so many complicated surgeries for so many patients in the general domain as well. But for one needle, it used to be quite hilarious for me. So it kind of took away some of the anxiety and stress, and created a more humorous environment for me as well. So yeah, so she had 4 cycles of chemotherapy, and that's not because the cancer was progressed or something. It was just, it's part of the treatment that if you have surgery and you have undergone that, just to prevent any circulating cancer cells that might be there, it's only a might, it's not definite. So that was what the chemotherapy was for. And then fast forward from that in October with the PET scan. She didn't have any PET scan since April till October. So for me, it was like, oh, I need to somehow, it would be nice to have a PET scan. I kept reminding her about it, because normally the route we take is every 3 months, but I do understand, every 3 months for a PET scan has quite a high dose of radiation as well. Of course, you just have to go through it, but that waiting period was a lot for me. But in the end, it came up as, no evidence of disease, and that's just wonderful. So I'm sure, I hope whoever is listening, whether you're a lung cancer patient or not, there's plenty of hope in repeating it again.
Dr. Rita, do you have any plans of writing a book?
Yeah.
I have mentioned that to her many times, Roy. Yes.
I've written little excerpts. I've written little excerpts actually. How it was. I was diagnosed initially, and sent it on WhatsApp itself. And my experience in the hospital at Kambala Hill, there also it was very challenging, very nice. There was a patient next to me, and she was a South Indian patient with a tumor of the jaw, and she was there with me. That was another new experience, and that would have made that also would have made a story. I'm writing small things, little things.
Yeah,
small.
You should write. That would be an inspiration to many of us.
I've written actually. I'll let's see how I pass it on.
When you start writing, the end will find itself.
Yes.
Yes, I like that.
That's why I said today. I mean, 1.5 years ago, I felt like I was walking on a cloud. Today, I'm still on a cloud with this no evidence of disease. And I keep telling everybody, look, I have stage 4 lung cancer. Whether you like it or not, hear it from me. So everybody feels very, encouraged by those words. They say you can't get over me. They've always been positive. That's my attitude to life in general. Always been positive.
Mom, there's Dio Dita from this group who's asking, is lung fibrosis and lung cancer different? From a clinical perspective, can you say something on that?
Yeah, it's different. Lung fibrosis is quite different from lung cancer. Very different. And the etiology of lung fibrosis also, there are so many causes of lung fibrosis. One of them may be autoimmune, which is different from lung cancer. But the symptoms may be the same. They may, appear like asthma, like bronchospasm asthma. So lung fibrosis also can be difficult to diagnose initially.
There's a lot of advances. Please.
Yes, sorry.
Yvonne.
Is there any cause why we get this cancer? Have you found any cause? If you have excess of meat or sugar, some say white sugar.
Nothing. I've been having a chocolate, half a Cadbury's chocolate every night. In fact, for the last so many weeks. I suddenly felt like having a chocolate. I had it. So some say, oh, you shouldn't. I said, why not? Who told you? My doctor hasn't told me that. My oncologist says, have whatever you want. There's no problem. So long as you're not diabetic and you're active. I still do my line dancing. I still do my exercising every morning. And still do my house mopping like I always used to do, since 30 years.
So
25 years.
We don't know what is the cause. It just comes up.
Of course, because there was this mobile cell tower in my building, it's a 6-story building, and they had this mobile cell tower since about 10 years. Yeah. I had it removed. I said, ionizing radiation scan course. So I had it removed. I made a noise about it. I said, okay, you've got one specimen in this building. You want more people to, have more problems. Because Tata's also has done a study, and they're not sure. They've not yet come out with the final report. But we need to do a study on this, actually. How many persons in these kind of buildings have developed cancer? Because practically every tall building has a mobile cell tower these days. So you can go into it and find out and do an ongoing study.
Is milk harmful for cancer when you have cancer?
No, not at all. No, why would it be? No.
Pardon?
Not at all. I have milk every day.
Okay.
It's a source of protein and calcium.
To stay away from cancer, should we stay away from any particular kind of food?
Somebody has asked a question right now.
So long as you're moderate in your food, whatever, whether you drink or don't smoke, no smoking, but drink, moderate, everything in moderation, there's no problem. You carry on a normal life. I've lived a normal life for 66 years.
Hello, hi.
Hi.
Oh, yes. Hi.
Iqbal Singh.
Hi, how are you?
Hi, Iqbal.
Can you see me?
No, we can't see you.
Oh my goodness, you can't see me?
No.
So your video has to be put on.
Oh, the video has to be put on. All right, can you put on the video? Yeah, I have a computer savvy guy, so he's gonna do it for me right now.
Yes, we can see you.
Hello, yeah, should I say, let me introduce myself.
Yeah, I can see you now.
I'm not Iqbal Singh. I'm using my Iqbal Singh, he's my computer savvy guy. My phone died, unfortunately, but Philomena, I've been, what should I say? I studied with your mother a long time ago. I'm speaking from Toronto.
From Band School.
Okay.
Oh, wow.
Anyways, I say it should be about 3 a.m. right now, I believe. So I'm so excited. You would not believe I'm so excited. She went through a perfect recovery. And
that is so inspiring that you're up here for us at 3 a.m.
happiness. Yes, I must say that first thing. And I just want to share a little bit of what I see in my lifetime, 30 years in a hospital that I worked in Toronto.
What happened? You got fever?
Am I still on?
Yes,
very much.
Okay, great. As long as I'm on a video, so I can't see you right now. Let me put that on. Is everything okay, right? So, guys, can you hear me?
Yeah, I can hear you.
Yes, very much.
Absolutely.
We can
Wonderful. Rita, it's wonderful to have you on a stage, both of you, mother, and you got wonderful daughters, blessed daughters. Very nice. Nice to hear that. So coming back to my question, like I've been 30 years in this the world of hematology, put it that way. Not a doctor, the world of hematology. So my everyday routine since I came to Toronto, joined one of the major hospitals, UHN, and I was working on continual basis, and I learned a lot about hematology. Explosive knowledges, like as far as morphologies are concerned. So I do microscopy like day and night, that kind of thing. So my first thing was when Philomena mentioned about the predominance of adenocarcinoma, and it's like, in my mind, I see that every time. It's very, very common for us to see adenocarcinoma, then the small cell with all the old cell carcinoma, or the large cell carcinoma. The adenocarcinoma are the most prevalent.
Yes.
And sometimes in the bronchial lavage that we see through under the microscope, we can detect sometimes out of 100 cells, even one will be standing out as a malignant cell. And it does, I think, trigger kind of an early diagnosis, but we have to send that report and they will do the follow-up testings and all the other genetical testings that have been done. And since we have the hospitalists also dealing with the cancer patients, we have 3 hospitals combined together. That's why they call it the UHN hospital. So, and then we can understand how patients are getting treated, all the PET, analysis taking place, all the targeted therapies taking place. And that's also one of the things that's been done in Toronto. I'm saying Toronto, but actually it's all worldwide in North America now. And it's well-known therapy, and it's does work in certain individuals. And I'm glad it's worked with your mother, and it's worked very nicely. Yeah, sometimes, as you mentioned, one has to go through several combination of different therapies overcome and to check the progression of the disease, right? So I'm
Absolutely.
just here not to really, I learned a lot from you, Philomena. It's very nice knowledge that you expounded. Very delighted. And I know you have a very good in depth. You don't have to get that out. People do not understand otherwise, right? I understand that part of it too. So you're very well. I'm glad to watch your platform today. And I wish actually your mother all the best all the way.
Oh, it's very
and
lovely to have
these
you
two
here.
hands together for her.
Yes, indeed. Thank you so much,
Iqbal.
Uncle. Thank you.
I'll see you on
Most
our
welcome.
group, on the 1971 batch group, Iqbal. I'll see you there.
Yes, you remember that. Thank you very much.
Thank you.
I'll give other people a chance. I know it's been a tiring night for a lot of people out there. So I'll definitely get in touch with you later on and we'll talk about this. Thank you very much.
Yes, of course. Thank you.
Thank you.
I'd just like to tell everyone that Rita has been very kind in bringing so many people to our platform. But, but before, you just made a statement just now, and that supersedes all the other guests that you are bringing in. You said you spoke about line dancing.
Yes, I've been practicing one for our alumni get together next year too. My classmates are waiting. Is it?
So can we have a session of line dancing?
Yes. Yeah, we'll do it together live. We'll do it live together.
No,
I think this is a new challenge, Roy. This is a definitely new challenge.
You bring all your line dancers.
Yes.
And with your cameras on, it shows the spirit of mankind.
We would love to have that experience.
Oh, sure.
And you'll have to also breathe loud and show us that time. And this is how it is. It's wonderful.
You said you did some lung exercises. What
Yes,
are they?
I do lung exercises.
Should we practice them?
Yeah, you should. You can go for your yoga. I have no problem. You go for your yoga to improve your lungs. Many people say we go for yoga. I said do that. If you're for your lung capacity, improve your lung capacity. Excellent. So there are lots of exercises for lung. I can teach you.
Is there anybody who could teach us that?
I'll teach you that.
Oh, that's lovely, Roy.
Yeah.
She's going to teach us some lung exercises. I think you all need to do it.
Everybody, for everything, your complete body. Because the more you exercise your lungs, the more your lungs expand, the more oxygen exchange, the more stamina you will have to be able to do lots of other physical exercises. Lung capacity is important. That's why I do a lot. And it's because of my physical fitness that I bounce back so fast after surgery. Lung surgery is a very painful experience, very, very painful experience. For almost a month and a half, I had to cry with pain, but keep popping the painkillers. But the lung exercise and the fitness, your fitness, basic fitness, brings you back. If I had been an inert person just lying about and lying around and not doing anything, I don't think I could have got back to surgery so fast. And cardiac surgery involves standing for 4 or 5 hours sometimes, at least 3 to 4 or 5 hours. So I managed it with help from my friends.
So you must be having very strong calf muscles.
Yes, I do have very strong calf muscles. And I exercise that every morning without fail, not just now, since about more than 20 years. 20, 25, 30 years, right from my...
We have our yoga sessions normally on Saturday morning, 8 o'clock.
Okay.
So if any Saturday you are available,
yeah.
Teach us what Yvonne has asked.
Where do you all have your yoga sessions?
No, on Zoom.
On Zoom, I see.
Yeah. You come there and make sure Dr. Christina also does some exercise.
She does marathon running.
So, your story has been so inspiring today. And if one of these Saturdays, if you come 8 o'clock in the morning, it's available. If the slot is there, free for you.
Yeah.
And we have a session. We have about 10, 20 ladies who are always on yoga.
Okay.
and they'll join you, and maybe I too will. And,
I don't do the yoga because some of them can be very difficult, sitting cross-legged and all this.
No, whatever you can teach. The whole
I do
idea
very
is-
simple exercises, very simple ones which anybody can do.
Anybody,
Anybody
sharing.
can.
Lung exercises are simple, aren't they?
Yeah. Take a deep breath, hold it, blow balloon. You take a balloon. One of the best exercises is balloons. Just take a balloon and blow it. Blow till it blows. Blow about 10 balloons. That's lung exercise. Or blow it and deflate it. Blow it and deflate it. That's lung exercise. One of the best lung exercises because I had to do that in the hospital. So the physiotherapist got me a
That's a
packet of
simple
balloons.
exercise that everyone can do.
Yes.
Very simple.
Very simple. The
So we know
physiotherapist gives
things like this and we can practice.
You don't have to do any fancy exercises. Just keep even one balloon and one or two balloons. Blow it, deflate it. Blow it. But when you blow a unblown balloon, the effort required is much more than if you just deflate and try to blow again.
Yeah.
Because then the rubber gets loose.
Gets soft afterwards.
Get a packet of those party
You
balloons
can
for 20
start right
rupees.
away.
Yeah, for 10 rupees or 20 rupees, you get a packet. Blow them. Blow with all your might.
Very good.
I was so enthusiastic. In fact, before my surgery, she gave me left a packet of balloons. I got the instruction wrong. I thought she meant I had to blow all this before I get into the theater. So I blew all the balloons. My goodness, it was huge. So yes. No, but I blew them. I blew them because I have a very good lung capacity. Because of that, I didn't require a ventilator post-op. I was out. I was out in completely back. Very well, in fact, after anesthesia surgery. I had other complications of anesthesia, but not because of my lungs.
You must start right away.
Yeah.
It's a good practice.
Yeah. You can decorate your houses or donate them to parties, children's parties, balloons for you.
We'll try. Thank you so much. Thank you.
There's a question from Thelma. She was asking, what happens when you have weak lungs and or low lung capacity? And the other bit was, what is the reason for hyperventilating? Is that because of a weak lung? She's asking. So I thought, Mom, you'll be able to mention it from a clinical perspective
I'll
better.
have to talk to her. I'll have to talk to her. Where is she from? Thelma from?
I don't know.
Yeah, I'm from Mumbai.
Okay. You stay, where do you stay?
It's not, yeah, I stay at 7 bungalows. It's not for me, actually. It's for my daughter.
Huh? How old is your daughter? I'll need to know a history.
She's 38.
Okay. And what is this problem that she has hyperventilating? Why?
Now the doctors they have told her that probably she has an anxiety issue.
Oh, okay.
But I don't know, since I'm listening to you and you're, all along. So, I mean, she's undergoing some tests right now, and she did her heart test as usual. It's normal. So they have asked for some more blood test. So she's in Doha and I cannot control much from here. But
okay.
What are the suggestions, like, or investigation she has to do? Or is it just an anxiety attack, which I
Definitely
don't know?
a pulmonary function test would separate that anxiety attack and a pulmonary function test.
Okay. Because she her pressure drops and she gets all cold, and then she takes almost about half an hour to recover after that.
Is she very slim?
No, she's not. She's a mother of 2, so she's just like a normal. Yeah.
What is her normal blood pressure? That we'll have to check. What is her
she's
baseline?
I think she's always on the lower side.
That's fine. Then she needs to take plenty of fluids.
She needs what?
Liquids to drink.
She needs to drink a lot.
Yeah,
of
perhaps
water,
with a pinch of salt in it. Yes.
Yeah.
I have that problem too. All my years.
Okay.
I used to regularly faint in the long clinic, standing around. I used to regularly have this fainting episode, even in school days. So I solved that with this pinch of salt in a apple juice or some tang or something like that. Lime juice, lemon juice.
No, now the thing is, after listening to you, I mean, is it how do we just know that it is an anxiety thing? What is her problem, or there is something more to it?
Yeah, so
She's even in the process of leaving her job because maybe she thinks it is stress related.
Yeah, yeah.
She cannot handle the stress at the work right now. So yeah, all in all, I'm confused.
No, stress is one of the worst.
Yes.
It can cause anything. So
Yeah.
perhaps it's good for her to take a break and get, maybe not just leave her job, take a break and have her fully investigated in Bombay, in India.
She cannot come down to India for a long time. Max, she can be here for a week, which is not enough, I guess.
Can she take a longer break?
Because
Longer break.
yeah, she's got two little kids and they need to go to school and husband working and stuff like that. So, I mean, what shall I tell her to get her doctors to? It's very difficult to tell them to do this or that. You know, they will.
No, I understand.
Yes, you're not your own advocate. That's
yeah,
that's the problem.
and especially in Doha, you don't have any control over the medicals over there.
Correct.
One doctor put her on, antidepressant tablets. So she has not yet started them, but I think she's waiting for another opinion from the Hamad hospital, and then she will take a call. So I'm just hoping it's nothing severe to do with the lungs, as I was listening to you. I just hope it's an anxiety thing and we can resolve it with meditation and breathing.
Yeah.
So
yeah, exactly.
Yeah. As
she
of
needs
now,
to do a lung function test. A lung function. Get
a
that.
lung function test.
Yeah. Pulmonary function. It's called a pulmonary function test.
Okay. And any other blood test like she should be doing?
No.
Okay. So
not anything specific. They would have done all the baseline ones, and if there's something abnormal in that, they would be able to tell you. But specifically, a pulmonary function test would be able to differentiate whether she has a lung problem at all.
Right. Okay. A lung function test. I'll remember that. Yeah. Yeah. Thank you. And it was, I started off listening to you with such a heavy heart, and then I'm feeling much better now. Listening to you. No, seriously, I was like, should I even listen to this or what? Because I'm another person who has, I get anxious so fast, because I have no control over her being away, and I don't, I just see her on WhatsApp calling and stuff like that.
Right.
So so I was really, really anxious about this whole thing. But yes,
don't get anxious. You see, we're all on that line. We're all in that one line somewhere. You might break a queue, and you're trying to. You can't go ahead. You can go ahead, I suppose, but you can even go behind somewhere on that line.
Correct.
You've got to take each day as it comes. No.
Absolutely.
And no point getting anxious. You've got to face.
There is no point. So right. Yes. And thank you so very much, Philomena.
No, most welcome. I'm happy you joined it, and you actually stayed for everything more or less. Yeah.
Yes. So I will have her to do a lung function test. Right.
Or PFT as they call it, pulmonary function test. Yeah.
Okay. I'll just note it down.
PFT.
PFT. Okay, PFT test.
Pulmonary function test.
PFT test. Yeah. So, all right. Yeah. Thank you once again. And wishing you all the very best.
Thank you. Thank you so much.
Thank you very much, Thelma.
Thank you.
Do we have any more questions?
Yes. Anybody else wants to ask anything?
Yeah. Before Dr. Roy shuts shop.
Shop with all the video icons on.
Yeah.
Roy, if anybody has any questions, so they could even talk to me later on.
Yeah, we'll do that.
Yeah,
that's customary. Before we do the vote of thanks, can we have all the videos on, please? All the videos on.
Come on, everyone, unmask yourselves.
Unmask yourselves. Let Uncle Roy see each one by face.
Roy knows that my camera is not working.
Yeah, Angela, you're the only one excused.
Yeah, thanks.
Marina.
There is one Galaxy A92018 621 BDCB. Andrew. Who else is there?
Sheila, Casey, Judy. They all have to unmask.
Geronio. Okay, Geronio came online earlier. And who else is there? And Gracie Gobias. I think Gracie, I will shut her out from this shows. She doesn't come online. Sheila, what's happened to you? You can put your camera on.
Daryl Menezes as well.
And okay, I'm taking the traditional photograph. All of you come with your best smile. And that's my friend Daryl smiling.
Yes, Dr. Roy, thank you very much.
I'm just taking a shot. Okay, 1 minute. Joanna, why are you so serious? You can also smile. Don't just because it's a medical session, it doesn't mean that it is a serious matter. 1 minute. And page 2. Christina, how many cameras you have put on? There, Sheila.
I was logged on to my phone, sorry.
1 minute. Okay, I've taken both the shots. Telma, were you the one who was asking these questions? I can't believe it. Your daughter is there. You look like the granddaughter, man. Anyway, hello. And who would like to propose the thanks? All of us heard. Marina, can you propose a vote of thanks to Dr. Rita and...
Right? Couldn't you find anyone better? Anyways,
what's wrong with you, Marina? You're so pretty,
Dr. Rita and Dr. Philomena, on behalf of Shepherd's Flock and this medical group, which we've all attended, I just take the opportunity to thank you for sparing your time and coming here to, give us all this knowledge about cancer and especially lung cancer. It was really very inspiring, and especially since I had a good friend of mine who's having this problem. It was inspiring for him, and I'm sure you will help him out. I have full trust in you all, both of you. Okay, so please do help him out. I'll get you all the reports concerning him. Thank you so much for answering all our questions, and may the Lord bless you both and make use of you all for, helping the others who are really suffering. Your testimony was awesome, Dr. Rita. We will all learn a lot from that. Thank you so much. God bless you both. And hope to see you all both again sometime later.
Yeah, she's coming with the line dancing,
Yeah. We are waiting for the line dancing and many other sessions. Okay?
Yeah.
Thank you so much.
She has introduced,
God
she has
bless.
brought in on the platform at least maybe half a dozen more doctors. They're just waiting in the pipeline,
That would be awesome.
Yeah.
Roy, it sounds as if this is some pharmaceutical firm, with all the doctors waiting.
No.
This group is only for medicals.
Yeah, medical, this particular group. And I met her through Annette for the first time. But after that, it's just rolling. Okay, Roy, you get this doctor, he's an oncologist. You get this, he's a cardiac surgeon. You get this, is this. I said, wonderful, yeah. So it's just, this pandemic has changed the entire dynamics of how people look at each other.
Yeah, sure.
As Dr. Rita in between said, you today, me tomorrow. So, it's anything is possible.
Yes.
So the good that we can do, let us do it now.
Yeah, nothing belongs to us. No, nothing is permanent. Nothing is permanent. Nothing is belongs to us. It all goes around. The world goes around.
Yeah, the world goes around. Suddenly, at least they should say, there was a good soul.
Yeah.
Yes.
And if Dr. Rita was healed, anybody can be healed.
Yes. That's why I said you write your book. I'll be the first one to read that book.
Yes.
So sweet.
Yeah.
Thanks, Roy. Thanks, Marina, for those lovely words.
You're welcome. Thank you, both of you.
Thank you.
Bye, everyone.
Yes,
Another session coming up soon.
And please get in touch with us,
I
Geronio.
will.
Please do get in touch with us.
Yes, yes. I'll give Dr. Rita's numbers to Marina.
You can do that.
And that one chain will continue.
Yes.
And Telma, you can contact Dr. Roy. Huh?
Yes, yes.
You see, life is all about being in the cheer, man. You can't be tense. My mother died of cancer, brain cancer, at the age of 46. We were very young. If you go to St. Michael's Church, there is one tablet that says the rose still grows beyond this wall. That's my mother. We just thought that she went beyond the wall. She never died. You were very young, but that was the wordings we inscribed on her stone. The rose still grows.
Very powerful words, very powerful.
Yeah, and we children have just followed. Anytime we come into a crisis, we just say, if mom was alive, what would she have said now? Answer God, problem solved.
Yes, it's a nice one, yes.
So that's how we move through life. We four children, we are four of us. And that's why I told Alma, don't take life too seriously. Even the gods have died, you know. So there's nobody has gone up alive. So let us live life one day
Is
at a
brain
time,
cancer
happily.
the worst form?
Sorry?
Is brain cancer the most dangerous?
Actually, yeah, in 70, she was a very pretty woman, you know. And she was loved equally by all. She was a working woman. She was a secretary to the naval headquarters that time. And she had breast cancer. And they did, because of her beauty, they said, no, don't operate, don't do that. And they did chemo and whatever, radiation, cobalt 60 or something they did at that time, 1976. But 2 years down the line, it hit her brains and thy kingdom come. That was it.
Today, the breast cancer, again, treatment has been revolutionary. So much of research has changed.
Roy, you'll have to
What
excuse
about brain
me.
cancer? Is
Yeah,
there
yeah,
any
yeah.
relief from that?
Yes.
Please excuse me. I have to go get ready for the next session.
Yes, no problem, Marina.
Thank
Please,
you.
please.
Bye.
Thank you very
Bye.
much.
Bye.
Yeah,
Thank you
bye.
so
Bye,
much,
bye.
Dr. Rita, Philomena, and everyone else who attended.
Yeah,
Thank you so
Marina
much.
has got a very special role in the next session. Huh? She's the videographer.
Okay.
Thank you.
Hello. Bye. Bye.
Yeah. So that's how it is. You know,
Is brain
Roy, thanks a
cancer
lot.
very dangerous, worse than the others?
Oh yes,
Thanks for coming
brain cancer is it's a very rare cancer, but one of the most common adult brain cancers, actually. These
A friend of mine
glioblastomas.
was detected yesterday.
Oh.
She was disoriented. She couldn't remember anything. And she started bringing up and things like that. Sent her for an MRI. She has a 5 centimeter large tumor in the frontal edge of the brain. She's going to be operated tomorrow, they say.
It all depends on the biopsy. Let's see.
Yeah, it also depends on that. Yes.
And today there's a lot of very, very fine surgeries available for that also.
Science has advanced a lot.
Yeah, science has advanced. So you wouldn't say it is the
We're
worst.
so disturbed because she's a very good friend of ours. We worked together for 30 years.
Maybe pray for her. She will be well.
No, we will. Yeah, definitely we pray, because I know a singer who's quite famous, amongst us young people, who was diagnosed with this glioblastoma at stage 4, inoperable. But it's more than a year and he's very much alive and doing amazing. He's even performed. You can look up his name, Tom Parker, his name is. It's been really a sensational journey for him as well. And at the time of his diagnosis, his wife was just about expecting. And the little toddler he had was also very young. But what an incredible way to move forward. It's just superb. I have been following that journey as well. That's why I'm sharing it with you, since it's very relevant in the story you've shared, Bjorn. So yes, please do look up his name, Tom Parker.
I will.
He's part of a band, and they all had sort of gone their separate ways for a few months, and now they all came together, standing up for cancer with him there. So it was incredible, superb. So they told him, it's inoperable and nothing's can be done. But there he is, fighting fit as ever with all the chemo, of course, but he's done really well.
We were together just 2 weeks ago. We were enjoying ourselves, had lunch together, and suddenly we got to know this. Very disturbing.
Yes, yes, it is. It is. But hang on, you must tell them that to hang on, because there's plenty of progress there as well.
I will be the bottom Parker. Sure. Thank you so much. Thank you.
You're most welcome, Bjorn. He too also has been doing some very active advocating, for adult brain tumors.
Okay.
So it's really amazing the things he has been writing, both him and his wife as the sole caregiver. So that's what it was actually me who came up with this book idea. I've been writing various things as a caregiver. So on Instagram, you can follow all my stories on it. Every instant we had some obstacle with mom, I had a story behind each and every one of them. So that's why I've been engaged with all these patients, about 3,000 of them all over the world. And we are on this third generation platform on social media. And they are all, the things I've learned from them, I don't think I'm anywhere close to any of their warrior attributes, honestly.
Dr. Rita would be knowing, my mom was operated by Dr. Daftari in Bombay Hospital the first time, Dr. Wagh second time, and Dr. S.N. Bhagwati the third time.
Do you know those names?
Dr. Bhagwati, whose brother was Justice Bhagwati, very big people. 4 operations, brain surgeons, in a span of 1 year. She was 1 year in Bombay Hospital. And she went in walking and she came out. That's history. Anyway, you have to live through life. Yeah.
Yes, but
dance your way through. You have to dance.
Thank you so much, doctor. Thank you.
Most welcome.
But do write your book. I'll say before we end the session. I'd like to read what you are writing. Because you speak very well. You speak better than me. And Dr. Christina, how long are you here? You are muted.
Till end of the month.
Until end of this month. Okay. Great.
My ticket is not yet booked, but so.
God bless. God bless. Just here to serve society. Thank you so much. We'll wrap up the session now.
Yes, of course, Roy. Yeah, thanks so much for giving us this opportunity like this. It's incredible. It's one of the first I've ever done, a live webinar session.
I'll post the link on YouTube. The YouTube link, I'll post it on the group, and Mom can share it with you. I don't know whether are you part of that group?
No, Roy, I'm not. It would have been nice to be part of it. Yeah, definitely. So I will pass on my WhatsApp number to Mom. Then she will.
You pass it on directly to me, man. She might stop it there.
Yeah, she's very. Mom is very difficult. but she's very tech savvy, Roy. You have to be careful. You have to be very careful of her.
No.
Because all of a sudden she knows more than I do sometimes.
Hello, then we are ending the session now. Yeah.
Yes, Roy.
Bye. Thank you.
Thank you.
Bye, Bjorn. Yeah, God bless.
Thank you once again. Thank you, everybody. Thank you, Roy and Philomena, Rita.
And Thelma keeps smiling.
Welcome, Thelma.
Yes.
Don't let anything
Roy,
come in the way of your smiles.
Now.
That's it.
Roy,
Yeah.
That is the takeaway you got from this session.
Absolutely. Thank you.
You have to fight through life.
Yes. Thank you.
Yeah. Bye.
Bye-bye.
I'll see you again soon for the next session.
Yes, of course,
Next session.
Bye.